Hi, everybody. I'm Dr. Bryan Ardis. This is the Dr. Ardis Show and the long-awaited what you need to know about cataracts to prevent them, how to reverse them, and what creates them. You're about to learn it all. I am shocked by the amount of information I have collected in my research on what are the true causes for cataracts and how do you prevent them and how do you reverse them. I promise you, you're going to be shocked too. So anybody out there who is under the belief that cataracts are just a part of old age and aging, you've been lied to. In fact, you've been massively lied to, and you're going to be shocked at what I uncovered and what you're about to learn. There is so much information behind the cataract issue in healthcare that affects millions of people around the globe that this is going to have to be divided into two parts. So this first part is going to be what your medical doctor is not going to tell you about what causes cataracts. The second part is going to be what are the published antidotes, known curing potential products, components, herbs, minerals, vitamins, dietary recommendations to prevent and reverse cataracts. All the antidotes will be in the part two. So this part one, all of you need to watch. All of you need to share because you're going to be shocked about the lies you've been told about cataracts. You have all been told it is primarily just an age-related disorder leading to blindness and required cataract replacement surgery of your lens in your eyeball. I'm really sorry, but we've all been lied to. So I'm very excited to present to you what I've learned. So stay tuned. This is going to be very exciting. This is a very thorough presentation, this first part on what are the known published causes of all cataracts. Very excited to share it with you. And we're going to dive right in. As always, my presentations come with PowerPoints with the links to the research articles I'm quoting and showing. And also, I download them into a PDF form. You can find them at Patient Resources tab at thedrardisshow.com. They're free. Just go download the actual PowerPoint. You can share it, email it, give it to your friends. You'll see all the antidotes. You'll see all the causes and all the scientific references for everything that we're presenting about cataracts. I love my eyesight. I think you do too. I love being able to see the world around me. Couldn't imagine losing my eyesight. And if there are ways to make sure that doesn't happen, reducing that burden so we can all see life the way it was designed for us to experience, that's the purpose of the Dr. Ardis Show, especially this one. Here comes the PowerPoint, full screen now. All right, we titled this Cataracts, What Your Doctor Won't Tell You. This is part one. Scan the QR code to get on our email list so you can be notified about each health topic as I present them. You'll get free access and notifications of when those PowerPoints and those podcast recordings are ready. Let's look at what is published about cataracts. How big of a problem is this worldwide? Global estimates on the number of people blind or visually impaired by cataracts up until 2020. This study reported that cataract remained the leading cause of blindness with approximately 15.2 million cases. That comprised 45% of all global blindness worldwide. 45% of all the causes of blindness around the world is cataracts. It's the largest. Cataract also remained the second leading cause of moderate and severe vision impairment, abbreviated MSVI, with 78.8 million people affected, which comprises 39% of the global moderate and severe vision impairment issues around the world. This is why you need to share this with everybody you know, because millions and millions, tens of millions of people every year are losing their vision to something and they don't know why. This is the lie most of them have been told. The majority of cataracts are age-related nuclear cataracts. The lie is age-related. The majority of cataracts, they want you to know medically and in the media and by your medical doctor, the majority of cataracts you're going to hear are age-related nuclear cataracts, which they say typically cause vision loss in the sixth decade or later. Cataracts, part of the spectrum of diabetic eye disease, are also increasing due to a global epidemic of diabetes, with diabetics more likely to develop cataracts and more quickly lose their vision to cataract compared to people without diabetes. If you have been diagnosed with diabetes, particularly type 2 diabetes, you need to be paying attention to our podcast, our presentations, because we educate you on how to prevent and reverse the majority of all diabetes. And yes, the more diabetes, the more cataracts and blindness. What they want you to know is surgery is the only treatment for cataracts, during which an artificial intraocular inside the eye lens replaces the damaged lens Now, you've heard this in drug commercials our entire life, at least the last 30 years, as they've allowed drug companies to market directly to you their products. You've heard the term, ask your medical doctor if this drug is right for you. Well, this slide I titled, Ask Your Medical Doctor If Cataracts Are Right for You. And this is why. They will tell you the majority of cataracts are age-related nuclear cataracts, which typically cause vision loss in the 6th decade or later. But did you know this truth? That it is published in research studies all over the world that over 70 drugs, prescription drugs, have been associated with a known or suspected increased risk of cataract formation. Did you know that there's 70 prescription medications that are known to cause cataracts? Do you know which prescription medications are known to cause cataracts yourself? Is your prescription medication one of them? You're about to find out. Here's a normal eye. This is what a cataract looks like. I'm going to show 3 examples of different forms of cataracts here, images. Here's another cataract. Here's another cataract. Cloudiness in the lens, and you can't see through it. Cataracts are the leading cause of blindness and low vision worldwide, with over 65 million patients affected in the year 2015. Current cataract treatment involves removal of the cataractus lenses I just showed you and replacing those lenses with a synthetic intraocular lens. Despite continued advances in cataract surgery, people listening, the number of patients affected by cataract continues to increase. Yeah, you're about to find out why. It has something to do with these millions of prescriptions every year, by the way. There are 3 primary types of cataracts. 3. And here they are. I'm going to show you what they are. There's what's called a nuclear cataract. That's actually the lens, and in the very middle area that you're seeing something cloudy appearing. I'm putting an arrow on the nucleus part of the lens that is darker than the other parts of the lens. That's a nuclear cataract. Then they have what are called posterior subcapsular cataracts. You'll notice the lens part is the white part you see on the image of the eyeball. You see a light blue colored nuclear area. That's what it's supposed to look like. The one on the left is dark gray because there's cloudy, darkened cataract in that nuclear part of the lens. But it's supposed to be white, the lens, with a highlighted little blue nuclear area. But a posterior subcapsular cataract is this little dark line you see behind the middle part of the lens. So it's just on the back side of the lens, closer to your brain. Then there's what's called cortical cataract. They say if you look at someone's eye with this kind of cataract, it looks like spokes on a bicycle rim. And you can kind of see it below where I highlighted the name, cortical cataract, or the words. But I want to highlight for you what they're talking about. If you notice the white areas of each lenses to the left, you'll see the white area is now all gray. That's the darkened areas of the cataract called cortical cataract. All right, so let's dive into what we know about is the only recommended cure right now for cataracts they want to tell you. It's cataract surgery. All right, the evolution of cataract surgery, the most common eye procedure in older adults. From medscape.com, this is what they tell you about cataracts. Cataracts, the clouding of the lens, is however becoming an increasing problem. Yeah, there's a reason. Between 1994 and 2003, the proportion of older adults who self-reported the presence of cataracts rose from 14% to 20% in the Canadian Community Health Survey. Cataracts are a major public health issue, especially in developing countries, since they are responsible for 47% of the world's total blindness. It can't be just age-related when the BBC's reporting in February of this year, 2024, maternity ward to pilot new cataract technology. And there's a picture of a baby, a newborn baby. This was shocking to me. An innovative new device, which could help diagnose cataracts in newborn babies, is being trialed in a Dorset maternity unit. Is that shocking to you? About 1 in 3,000 babies are affected by cloudiness of the eye's lens, known as cataracts, according to the National Health Service of the UK. It is hoped that this new tool will be more accurate than the current technique, which involves using a medical eye torch called an ophthalmoscope. Ophthalmoscope is what it's called, sorry. Did you guys know that newborn babies have cataracts? I didn't know this. So it obviously can't just be an age-related issue. Yeah, there's a reason why newborns are born with them too. I'm not going to dive into that in this one. This is for the majority of people with cataracts. You're going to hear about amazing success stories with cataract surgeries. The only thing the medical profession says is your way to help cataracts at all. Here's an example of a really exciting, beautiful story of someone's vision being restored with cataracts, which is pretty par for the course for these surgeries. But I'm going to give you the downside too. I'm going to show you some pretty horrific stories. Clearing the clouds of cataracts, a patient success story. This is the doctor who performed the procedure. Dr. Tsai explains, quote, a cataract is the clouding of the lens in the eye. As people age, the proteins in the natural lens may clump together, making the lens opaque. You can't see through it. Well, just so you know, that is not true. This is exactly what medical doctors are taught. It's age-related, and the proteins in the eyes just naturally clump together. No, they don't. You're about to learn that there's many prescription drugs that absolutely do that. Then they're going to tell you in this story, most cataracts are related to aging. No, they're not. However, patients can often see very well the day after surgery, and it improves rapidly over the next week. That is what most people experience when they get these cataract surgeries. Another quote from the doctor for her patient named Michael. An example, quote, Michael's vision was 20/25 without correction, no glasses, no contact lenses, the first day after surgery, which was life-changing for him, which is awesome. Although patients are always happy with increased vision and function after cataract surgery, in this particular case, it was quite emotional. He and his wife, Dawn, were also some of the most grateful individuals I have ever had the pleasure to work with. What's the downside of cataract surgeries? Well, here's an example. The Boston Globe reported this article titled 5 Cataract Surgeries, 5 People Blinded. What went wrong? The lawyers for these patients stated this. They believe the errors in this case could have been avoided. Quote, when one patient ends up blinded, it raises a red flag because it's such a rare complication. He said, quote, when 5 patients are blinded, all on the same day in the same eye surgical center, it's really shocking. Okay, if you read this article, you're going to learn that the anesthesia they used before the procedure is what caused the patients to go blind permanently. So when they woke up after their cataract surgeries, they had no vision whatsoever for life. So not everything is just roses when it comes to medical and surgical procedures. All right, now I'm going to highlight cataracts on this, but this is the National Eye Institute of the NIH. You will see their abbreviation and title of the department down at the bottom right-hand corner. This is a publication of theirs, the most common eye diseases, NEI, National Eye Institute, looks ahead. They state here that between 2010 and 2050, the estimated number of people affected by the most common eye diseases in America, those numbers will double by the year 2050. Anybody upset by that? I thought we lived in the greatest healthcare system in the world. Why are more people in America going to have more eye problems and vision loss in the next 20 years than ever before? All right, so let's look at what they are highlighting statistically about the 4 major causes of blindness in America. Age-related macular degeneration. In 2010, there's 2.1 million Americans that have that. By the year 2050, it will be 5.4 million Americans will have vision loss or blindness from age-related macular degeneration. What about cataracts, which is what we're talking about today? In 2010, it was 24 million Americans that were diagnosed with cataracts. By the year 2050, it will be twice as many. It will be 50 million Americans will have cataracts and will then need cataract surgery. Diabetic retinopathy, losing your vision due to diabetes. 7.7 million had these diabetic retinopathy in 2010, and they expect 14 million will have it by the year 2050. What about glaucoma? They expect after 2.7 million were diagnosed in 2010, they're saying by the year 2050, 6 million Americans will have vision loss due to glaucoma. Now, I want to say something here. There is an initiative and a mandate right now coming out from Donald Trump's administration with RFK Jr. to make America healthy again. I just want you to know, this is what the National Institutes of Health is publishing since 2010. They know even the health of our vision in America is going to be twice as bad in the next 2.5 decades than it is right now. So how do we make Americans' vision healthier again? Well, obviously the federal health agencies haven't figured it out. The medical profession hasn't figured out how to stop this problem. It's just going to keep getting worse year by year by year. So the American medical industry is sucking at preventing and improving the vision of all people in America. It's very obvious. Look at the statistics. They suck at keeping your vision healthy. All right, let's focus on cataracts because that's this entire presentation. Cataracts from 2010 till 2050, they expect the amounts of cataracts in America to double. Here's what the NIH publishes about eye health, age and eye health. They actually state here, vision loss and blindness. If you look at the bottom, vision loss and blindness are not a normal part of aging, they say. But that's funny. They actually tell you in the research studies, cataracts are caused by aging. Not really. All right, so you're just going to see here 40 million Americans age 65 and older at 2010. By the year 2050, there will be 88 million of that same age range, which means they expect visually impaired people, 4 million of those 40 million, which is 10%. In 2010, it will be up to at least 7+ million of Americans in that 88 million by 2050 age range will actually have vision impairment or blindness. Now, they also highlight on this document on the NIH's website, what are steps you can take to keep your eyes healthy? They say you can eat a healthy, balanced diet. Don't follow the food pyramid from the FDA. Maintain a healthy weight. That doesn't seem to be working in America. We're fatter than ever. Don't smoke. Okay, don't smoke. Wear sunglasses and a brimmed hat when outdoors. Okay, great. I hope y'all are doing that. Control diabetes if you have it to prevent vision complications. Now, what you're going to learn, this is the summary of what the NIH says are ways to prevent your vision getting worse, even from cataracts. Eat a healthy diet, maintain a healthy weight, don't smoke, wear glasses, sunglasses, or hats, and control your diabetes, blood sugar. What is missing from here is one more, and I added this myself to this chart. I added another green arrow. What you need to know about how to keep your eyes healthy, the NIH didn't tell you, I'm going to tell you. They should have added this statement: avoid taking prescription medications that cause cataracts. That is one easy step you could take to keep your eyes healthy. You're going to be pissed about what you're about to learn that the medical profession and the scientific community knows causes cataracts when I'm done here today. All right, here are the drugs associated with cataract formation. They represent an unmet need in cataract researchers, says these researchers, Jack Carlson, Kate McBride, and Michael O'Connor. This has been out of Italy, actually. Let's dive into what drugs they know cause cataracts. Did y'all even know medications cause cataracts? Well, you're about to learn a whole bunch of them. Cataracts are decreased light transmittance through the ocular lens, your eye lens, termed cataract, is a leading cause of low vision and blindness worldwide. Cataract causes significant decreased quality of life, particularly in the elderly. Environmental risk factors, including aging, UV exposure from sunlight, which is why they said wear sunglasses and hats, diabetes, smoking, and some prescription medication drugs are all contributors to cataract formation. In particular, they say drug-induced cataract represents a poorly addressed source of cataracts. What the researchers are telling you is nobody's telling the people who are developing cataracts that prescription drugs induce cataracts. No one's talking about that. It is poorly addressed. No one in science, no one in medicine is wanting to address this. Well, these researchers do. They chose drugs to analyze belonging to any 4 broad categories that are already published about these drugs. Those which are known to cause cataracts. These are the categories in this research study. The drugs they're going to highlight that are known to cause cataracts. The drugs that are known to be probable to cause cataracts, which, by the way, means most likely causes. And then 2 other categories, drugs that possibly cause cataracts. And then there's drugs that have an unknown association with cataracts in patients. We're only going to stick with, in this presentation, the prescription medications that the medical profession absolutely knows causes cataracts, but your MDs don't know that, and they're not telling you, but the drug companies know. And the science and researchers know. And then what are the probable drugs known to cause cataracts? Collectively, these data provide valuable insights into specific prescription drugs that likely contribute to the increasing annual burden of new cataract cases. I just showed you the NIH said from 2010, there will be twice as many cataract people in America by the year 2050. There is an annual burden that's increasing every year of new cataract cases, and they are telling you here, this data about prescription drugs likely contributes to that increasing amount of annual burdens of cataracts. And yes, they do. This is where I got the statement I highlighted earlier. Over 70 drugs have been associated with a known or suspected increased risk of cataract formation. These drugs can be grouped into 4 distinct categories based on the evidence underpinning their association with cataract formation. And they're just going through and highlighting for those reading the study what those 4 categories mean. The first group is known category drugs are known to increase the risk of cataract in patients. That's the first category of drugs. The second is the probable category drugs that are likely to cause an increased risk of cataracts. We'll highlight that later. We're going to first focus on the known category drugs. They state that these are dominated by high and increasing glucocorticoid prescriptions. Sorry, I'm messing that up, but it's glucocorticoid prescriptions. These are steroid drugs. Corticosteroids are dominating this known category of drugs that causes cataracts. Of the 31 drugs that are known to increase the risk of cataract, in this research paper, they're going to discuss 17 were prescribed to many people in the country of Australia is what they're highlighting here. Take this same number and apply it to America because nobody's drugged more than Americans. They're going to tell you the data revealed 17 were prescribed of the 31 known drugs over the 5-year period they're analyzing, which was 2005 to 2009. Sorry, 2015 to 2019. The top 3 most prescribed known category drugs averaged more than 1 million prescriptions per year. And the cost was from 18 million to 55 million a year. Here is the list of the drugs, and I'm going to show you what those drugs look like. Read the title at the top. This is the table right out of the published research paper of what drugs they know causes cataracts. And they say here, PBS data showing prescription numbers and costs for members of the known category of drugs associated with cataract formation. All right, here we go. Let's highlight these. These are the drug names. You'll see them all there in front of you. Prednisolone, betamethasone, allopurinol, triamcinolone, methylprednisolone, prednisone, dexamethasone, hydrocortisone. These are all known to cause cataracts. You'll see on the right-hand side, the trend for the prescriptions over the 5-year period they're analyzing. They show you which ones prescription amounts went up each year after year after year after year. More people are being put on these drugs. You see the up trends, stable trends, meaning it's roughly the same year by year by year, and then which ones are going down in prescriptions. The majority are either up or stable. In red, I highlighted all the ones that are drugs that are increasing year by year in prescriptions that are known to cause cataract formation. Tamoxifen, fludrocortisone, amiodarone, methylprednisolone, triamcinolone, allopurinol, betamethasone, and prednisolone. And then I highlighted in blue those ones which are stable. They're staying about the same, which are in the millions every year. Let's dive into the drugs known to cause cataracts. This is prednisolone. I show you an image of what it looks like. And for every one of these drugs known to cause cataracts, I highlight for you, underline for you, the brand names of this generic drug known to cause cataracts. So you'll see on the list, for every slide I'm about to show, I highlight for you the brand names of those drugs. So the packaging you'll get, if you got the brand name, is what you're going to be familiar with. So for example, on the screen, you'll see brand names of prednisolone are Flowpred, Milipred, Orapred, Pediapred, Varipred 20, Prelone, Hydrelta, Hydroxyzole, Keypred, Catalone, Predicort, Medicort, Predcor, Bubbly, Pred, and others. These are all the same drug, just with different names. This one causes cataracts. Betamethasone dipropionate causes cataracts. The brand names are, you'll see on the right, Alphatrex, Betaval, Betaderm, Betanate, Betatrex, Delbeta, Diproline, Diprozone, Luxic, Maxivate, Cernivo, Teladar, Euticort, Valisone. I am not going to read all these. I'm just trying to get you familiar with what you're going to see on the screen. Remember, you can download this under the Patient Resources tab at the Dr. Ardis Show if you would like to have all of these, so you yourself can look and see, am I being prescribed a drug that is known to cause cataracts, and that's why my vision sucks or is getting worse? or you can share this information with people who are having these issues or concerns, or maybe they're on these medications and don't know they're going to lose their vision from cataracts because of these known drugs. These drugs are topical steroids. On the right of every image, you're going to see the brand names, and right below them is the drug class highlighted in blue, and it will tell you what is this being prescribed for. This is a topical steroid cream. Allopurinol, another known drug to cause cataracts. This is how it looks when your medical doctor prescribes it. It has brand names Xyloprim, Luperin, and Alloprim. This is an anti-gout medication. I don't even know how you pronounce this. Triamcinolone, brand name Aristocort. These are glucocorticosteroids for inflammation. Methylprednisolone. You'll see its brand names Medrol, Medrol Dosapac, methylprednisolone. These are glucocorticosteroids. These are also known to cause cataracts. Prednisone. Oh my God, millions of Americans, millions in Australia are on this drug. It is known to cause cataracts. Its brand names are these. I'm going to show these because it's such a popular drug. Rayos, Steripred, Deltazone. These also cause cataracts. How many people do you know are on prednisone? And how many of them later developed cataracts? Millions of them. Then there was a drug that was actually used during COVID-19 to treat hospitalized COVID-19 patients at a very low dose that a lot of medical doctors complained was an issue. Should have been higher dose. It's called dexamethasone. Did you know that dexamethasone is known to cause cataracts to form in your eyes? The brand names are Decadron, Dexpac, and Humadi. Dexpac, this is what it looks like. And Decadron, that's where it is. Hydrocortisone. Did you know hydrocortisone? Millions of you have been prescribed this to reduce inflammation, pain, you name it, for topical issues. Eczema, psoriasis, hemorrhoids, you name it. You'll see the brand names there of hydrocortisone. I'm not going to read them all. But here's one. You've all seen this on the shelf. Cortisone 10. This is hydrocortisone. Did y'all know that cortisone is known to cause cataracts? The primary ingredient is hydrocortisone. Just wanted to make sure y'all saw that. Amiodarone is another group of antiarrhythmics. This is arrhythmias of the heart. This is a heart drug. Pacerone. That's another brand name drug for the heart. It's known to cause cataract formation. Anybody you know on that drug? Look at this eye medication. You actually put drops of this in your eye. It's an ophthalmic or eye steroid drops called fluorometholone eye drops. Did you know fluorometholone that you're putting in your eye? Did you know that these eye drops, the drug in it, is known to cause cataracts? And look at the brand names. In case anybody out there knows anybody using steroid eye drops, you might want to know, is it a fluorometholone ophthalmic eye drop? If it is, they're called Flarex, FML, Forte Liquifilm, FML Liquifilm, FML, SOP, Fluorop, Eflone. Those are the brand names. Oh, the irony. What is this used for? I find this very amazing. This drug is a steroid medicine used to treat eye inflammation caused by surgery, cataract surgery, injury, or other conditions. Did you know the steroid they give you after your surgeries on your eyes causes cataracts? It is known to cause cataracts. Now, this is a very common drug a lot of people know about just by name. It's called tamoxifen. Its brand name is Soltamox. So this is for hormones, anti-cancer. It's an estrogen blocker. It causes cataracts. Raloxifene, brand name Evista. It's also for the same issues, hormone imbalance and estrogen issues. It causes cataracts. Haloperidol. Haldol is its brand name. I think I highlight that. I do. There it is. This is an antipsychotic drug. So antidepressants, antipsychotic drugs. Did you know that most inhalers for asthma cause cataracts and are known to cause cataracts? Here's one example, beclizone. Beclomethasone inhalation. I'm going to show all of these brand name inhalers later. There's a whole section just on inhalers that cause cataracts and are known to. You'll see the brand names there, but just know inhaled steroids cause cataracts and they know it. Cortisone creams, as you'll see on the shelves of many pharmacies, Cortisone acetate is a brand name. You'll see an example there on the screen. Cortisone, known to cause cataracts. Cortisone 10 has this in it. Fludrocortisone, Florinef acetate is the brand name. These are mineral corticosteroids, another drug prescribed to people known to cause cataracts. Busulfan, there's two brand names, Busulfix and Malarin. These are alkylating agents. I have no idea why they use those. But however, this drug intravenously is known to cause cataracts. The average annual prescriptions from 2015 to 2019, you'll read below, these are of the known category of drugs known to cause cataracts. And they're listing and highlighting here, these are known to cause cataracts and they're being prescribed for these typical conditions. And I want to highlight those for you. Haloperidol is for schizophrenia. Raloxifene is for osteoporosis. Amiodarine is for arrhythmias of the heart. Allopurinol, tamoxifen, bolsifen are for cancer scenarios. Then you have steroids for asthma, adrenal insufficiency, allergic and inflammatory conditions, allergies and inflammatory conditions like arthritis. As you can see there, the bars, the blue colored bar graphs are the amount of prescriptions annually between 2015 and 2019. You're seeing increases in all of these. So if you know anybody with schizophrenia, osteoporosis, arrhythmias of the heart, cancer diagnosis, or are on steroids for any kind of condition, asthma or inflammatory conditions at all, the drugs they are being prescribed, many of them are known to cause cataracts. And the longer you're on them, it no longer becomes an age-related condition or disease, cataracts. It is a drug-induced side effect. Ask your doctor if cataracts are right for you. And you might want to download this PowerPoint so you know if your drugs are on the list. These researchers published these statements, and you need to hear it. Overall, these data indicate that numerous known cataract-inducing drugs are being increasingly used. Well, if there's known cataracts being increasingly used, what do you expect to see? Increased cataract diagnoses. At a combined average annual cost of $212 million per year, of which in Australia, the government is having to pay $102 million a year for cataract problems. Check this out. Look at this statement, memorize this statement, please share it far and wide. The researchers looking at the drugs known to cause cataracts, I quote, "It is clear a large investment is being made to treat patients using drugs known to increase the rate of cataract formation." I repeat, it is clear a large investment is being made to treat patients using drugs known to increase the rate of cataract formation. There is more money being used to market drugs that cause cataracts to all people around the world and making sure they're being prescribed those drugs than ever before, and they increase the risk of cataracts. There is a large investment, and it is clear to the researchers the big pharma is making a large investment in treating patients with drugs they know causes cataracts to form. Now we're going to dive into what are called drugs that are probable to cause cataracts, and we're going to define from the research study the word probable. From Oxford's Learner's Dictionary, probable is defined to mean likely to happen, to exist, or to be true. So drugs which are likely and are true to cause cataracts. So these are also known to cause cataracts, and they're likely to happen. So here we go. Possible cataract-inducing drugs are dominated by psychotropic drugs. Oh my God, I couldn't believe this when I learned this. You guys are going to be shocked. Psychotropic drugs are drugs to help with mental illness, depression, anxiety, OCD, bipolarism, schizophrenia. Those drugs that possibly or probably cause cataracts are dominated by psychotropic drugs. Of the 23 drugs having a possible association with increased risk of cataracts, 14 were prescribed over the last 5 years, and they are going to highlight those here in a second. These drugs are typically prescribed for conditions from depression to diabetes. Notably, 8 psychotropic drugs were in the top 10 most prescribed drugs in this category. The top 6 most prescribed possible category drugs causing cataracts averaged more than 1 million prescriptions per year and cost over $16 million to $53 million annually. Now, these are the probable cataract-inducing drugs, largely involves a drug called methotrexate. So you have possible drugs, probable cataract-producing drugs. Of the probable group, 9 drugs classified as having a probable association with cataracts, only 2 were prescribed over the 5-year period. And those were methotrexate and pilocarpine. These drugs are prescribed for conditions including cancer and rheumatoid arthritis or glaucoma. I find this ironic. The drug called pilocarpine or pilocarpine for glaucoma, an eye vision problem drug, causes cataracts and is probable published to cause cataracts. Methotrexate is chemotherapy given to a whole lot of people that are really sick with autoimmune diseases. It dominates this category. Methotrexate averaged 330,000 annual prescriptions, with prescriptions increasing 28% over the 5 years analyzed. And here's methotrexate and the 1.6 million prescriptions that we're seeing in 2019, the cost and its trend, 28% increase year by year. Pilocarpine for glaucoma, it was down actually. It wasn't being used as much, probably because it was causing cataracts. Here's methotrexate. It has 3 brand names: Jalamvo, Zalmap, Trexall. Ask your doctor if cataracts are right for you. Pilocarpine eye drops for glaucoma. There's a brand name called Salogen. Did y'all know this is for glaucoma, but is known to cause cataracts? This is what the tablets look like. This is what the eye drops look like. Here you'll see the amount of prescriptions. In Australia alone, these bar graphs are identical, but on a higher number in every category. For America, you'll see methotrexate for cancer, rheumatoid arthritis, psoriasis, and intraocular lymphoma is a probable, for sure, most likely causing cataracts. All right, here's the other drugs that they say are probable. Remember the definition of probable? Likely to happen. That's the actual definition of that word. Let's look at their drugs. Here's the drug names. Here's the ones that have gone up over those 5-year period. Is citalopram, sertraline, fluoxetine, quetiapine. Now, those 4 drugs I just named, these are the generic names. You're going to be way more familiar with the brand names of these, and you're going to be shocked. And how many people do you know are on these drugs for life for some mental issue, and they're all going to go blind because these drugs are probable, meaning likely to cause cataracts. This is escitalopram, the generic name. What's its brand name? Lexapro. Did you guys know that people on Lexapro, they're taking a drug that will likely cause them to make cataracts? What about sertraline? Sertraline is actually Zoloft. How many millions of people all over the world are on Zoloft from Pfizer? Cataracts brought to you by Pfizer. Ask your doctor if cataracts are right for you when they prescribe Zoloft. They know this drug causes cataracts. This is fluoxetine. Fluoxetine has a brand name, Prozac. You see it there. Citalopram. Oh, sorry, I just want to stick with that. I mean, y'all know Prozac, right? Prozac, millions of people are on that. The generic name is fluoxetine. Seraphim, Repaflux, Salfemra. This is all the same drug. When someone prescribes you Prozac because you're depressed, ask them if cataracts are right for you. Citalopram. This has a brand name also. It's called Celexa. Millions of you are on it. Millions you know are on it. This is for depression. Did you know it causes cataracts? Quetiapine. This one I had to look up because I was unfamiliar with its brand name from the generic name. Its brand name is Seroquel, and most people know Seroquel for depression and Seroquel XR. These are also likely to cause cataracts, so everybody living on these medications, you're going to go blind. You might want to tell your loved ones. They know these drugs do it. Paroxetine. This is a drug most of you know as Paxil. It also has brand names Brisdel, Paxil CR, and Pexeva. Fluvoxamine, otherwise known as Luvox or Luvox CR. This is another antidepressant that causes cataracts. Glimepiride, called Amaryl. I'll show it to you here. This drug is called a sulfonylurea. Sulfonylureas. Now, this is a very huge class of drugs. There's over 100 brand name drugs. I'm not going to show you all of them, but I'm going to show you where that chart starts. And you should look up if you're on a sulfonylurea drug, a sulfa drug, as they call it in short. These are known to cause and likely to cause cataract formation, and they know this. Phenytoin, I don't even know how you say it, phenytoin or Dilantin, you see it on the screen, that's the brand name, or Phenotec. Gliminoclamide also causes cataracts to form. This is a drug that has massive amounts of brand name drugs all around the world. This is a drug called a sulfonylurea drug. Sulfa drug is what they usually call it for short. Here are some of the generic names on the screen for the same drug all around the world. So if you have a loved one that's on any of these drugs or a sulfa drug, you might want to find out if it's one of these. These are the brand names. Now, this list at this link you see on the screen shows you the names of all the brand name sulfa drugs around the world being used and prescribed right now. There are hundreds of them. I am not going to show you. I just did the top part of where they started with the A names of the brand drugs around the world that are sulfa drugs that they know are likely to cause cataracts and are published to cause cataracts. Here's a list of some of the sulfa drugs and their brand names for your convenience. Glipizide is the generic name, but there is a Glipizide XL, Glucotrol XL, the brand names. Then you'll see Amaryl, which I just showed you. And then a brand names Diabeta, Glycron, Glynase, and Glynase Prestab. These are the brand name drugs, and I'm going to show you what they look like. Here's Glipizide. Now we're going to go to cyclophosphamide. This is also known to cause and likely to cause cataract formation. Cytoxin, Neosar, Cytoxin are all the brand names. And then there's this drug that they know causes cataracts to form and are listed as a probable cause for cataracts. You may not know what this is in, but I'm about to show you. It's called benzalkonium chloride. It's an antimicrobial cleanser. It kills off bacteria. Its brand name is Curachrome Hand Cleanse 2-in-1 Merthiolate Neosporin Wound Cleanser. Yeah, I knew you would know Neosporin. This brand name drug. Did you know Neosporin? Its main ingredient, benzalkonium chloride, is likely to cause cataracts and published to do so. This is the drug Merthiolate. This is the other drug, Hand Cleanse. And this is a skin glue used for wounds called Curachrome. Curachrome, like skin glue. Did you know that it's known to cause cataracts? This drug is verteporfin, cancer drug. Its brand name is Visudian, and you'll see the image of it there. Here are some of the known Visudin side effects. A lot of these drugs I don't use. I don't prescribe these things, so I don't know how to pronounce them. You can read them and see them. If I mispronounce them, you can make fun of me. These words are crazy, by the way, the names of all these drugs. But I need you to see this about Visudine side effects. It has severe decrease in vision as a side effect and feeling like you might pass out on top of being known to cause cataracts. Not so sure that drug's a good one. The analysis of PBS data presented here shows tens of millions of prescriptions are filled every year in Australia and around the world for drugs known to or suspected of inducing cataracts. The most prescribed and costly of these drugs are glucocorticoids, psychotropic drugs, and cholesterol statin drugs are the ones most prescribed that cause cataracts. Now, we're going to show you a few research studies that highlight that they know these drugs cause cataracts. So this is from the journal called Clinical and Experimental Optometry. The eyes. What causes steroid cataracts? A review of steroid-induced posterior subscapular cataracts. Remember that visual I showed you where behind the lens was a little black line? That's the posterior subscapular cataracts. Did you know that steroids cause that? Prolonged use of glucocorticoids is a significant risk factor for the development of posterior subscapular cataracts. You're welcome. Ask your doctor when they prescribe steroids to you. Hey, doc, do you believe cataracts are right for me? Here's another research article titled Association Oral Corticosteroids and Long-Term Risk of Cataracts. So prednisone, if you're taking it, You have an increased use of corticosteroids. They state for various medical conditions raises concerns about ocular eye complications, especially steroid-related cataracts and glaucoma, which add to the global burden of visual impairment. Did you know there's just as many drugs that cause cataracts that cause glaucoma? This is not a glaucoma presentation, but the science already knows that these drugs cause both. And the more we prescribe them, the more glaucoma and cataracts you're going to see. But your medical professionals are told to tell you it's age-related. No, as you've gotten older, you've been prescribed more drugs. The more drugs you've been prescribed, the more cataracts you're going to develop. Steroid usage ranks as the fourth most significant risk factor for secondary cataracts, contributing to almost 5% of all cataract removals. The connection between steroid use and the development of cataracts was first identified by the researcher named Black and his research group in 1960. Well, what about inhaled corticosteroid exposure and risk of cataracts in patients with asthma and COPD? Oh my God, when I was a kid, I think I might have saw one kid in my elementary school that had an asthma inhaler. Now I think like half of all kids in America have asthma inhalers. Did you know that asthma inhalers, the drugs inside of them, cause and are known to cause cataracts to form? This is a table out of the research study about inhaled steroids for asthma and COPD patients, and the links that are published between those inhaled drugs for asthma and COPD causing increased cataracts. I'm just going to show you the highlighted summaries of these multiple research studies. I'm not going to read them all to you, but you'll see here, increased inhaled corticosteroid dose is associated with cataract development. That was just one study. Each of these found the more inhaled steroids used, the increase of cataract being diagnosed. All of them found the same thing. Remember, you can download this at the drardisshow.com in the patient resources tab. I'm not going to review all those findings. The findings in this review of available studies suggest a strong association between inhaled corticosteroid treatment and the risk of cataracts in COPD and asthma patients, with the meta-analysis revealing on average a doubled risk for cataract development in corticosteroid-exposed COPD and asthma patients. Do you know that those with COPD and asthma have doubled the risk for cataracts because of the drugs they're inhaling into the lungs every day? The meta-regression revealing a dose-response relationship between the steroid exposure and cataract risk. That simply states the more steroids used, the more likely you have cataracts diagnosed. This current study also found clear support for an increased cataract risk with daily inhaled corticosteroid dose exceeding 1,000 micrograms or nanograms. In addition, our meta-regression confirmed a dose-response relationship between corticosteroid exposure and cataract risk. Just want to drive that home. Then they found the threshold, the amount of steroid being used every day, that leads to increased risk factor for cataracts. It was at least a dose of 1,000 nanograms, I think that's micrograms actually, suggest a risk of cataract comparable to the risk caused by treatment with systemic corticosteroids. And then they say here, however, the study by Wang, another researcher, showed that the risk of cataract development is almost twice as high in patients treated with systemic corticosteroids compared to patients only treated with inhaled corticosteroids. So if they took oral ones versus inhaled ones, this researcher, they're claiming, found a double the rate for those using swallowed corticosteroids like prednisone versus inhaled inhalers. Let's dive into the inhaled corticosteroids, which is what IHC stands for, that causes cataracts. Here's a list of the inhaled corticosteroids. You'll see the generic names and the brand names. I'm going to highlight the brand names, and then I'm going to show you what the inhaler looks like in case you or a loved one has them or uses them. You're going to easily be able to see, oh no, I'm on an inhaler that causes cataracts. Oh no, my child or loved one is. This is what they look like. This is QVAR Ready Inhaler or Ready-haler. This is what it looks like. This is called budesonide. And yes, I know you know about budesonide with COVID. Budesonide is a generic inhaler, corticosteroid drug that was effective against COVID. Its brand name is called Pulmicort. This is what it looks like. And this is what the respules look like that you put in a nebulizer. Pulmicort is budesonide. Pulmicort is budesonide. Budesonide and Pulmicort are known to cause cataracts. The brand names for fluticasone systemic inhaled corticosteroids. These are the inhalers. Arnuity ellipta, Flovent disc, Flovent HF8. This is mometazone. Its brand names are Asmanex inhaler. This is what it looks like. And the twist inhaler. You'll see right there. Then cyclosinide, another inhaler that causes cataracts. It's called Alvesco. This is what Alvesco looks like. But I want to dive into prednisone of all the drugs. I was giving you statistics from research studies out of Australia and Italy earlier in this presentation. This is prednisone for the United States from 2013 to 2022. This drug is known to cause cataracts. The estimated number of prescriptions in the US in 2022 was 18 million prescriptions for this. Estimated number of people on them, 8,722,000. You know what's ironic about that number? That's almost the identical number the NIH said is going to have cataracts in America by the year 2050. If those 8 million people continue to take prednisone, they will have cataracts by the year 2050, 100% or sooner. We're going to dive into prescription medications, people. This is why cataracts are going to be doubling over the next few years, and all the other eye issues by the year 2050, the NIH reported. The percentage of U.S. population with usage of prescription drugs within the past month between 1998 and 2018 by age. I want to highlight something here. The blue bars represent 1988 to 1994, the percentages of the United States population that is on prescriptions. The black is 1999 to 2002. The gray is 2011 to 2014. The red is 2015 to 2018. I'm highlighting the 65 years and older group who most likely have cataracts. From 2015 to 2018, I'm going to blow this up for you. 88% of all Americans 65 years and older are on prescription medications in 2018. That's almost 90% of all senior citizens in America are on prescription medications. In the U.S. Pharmacist publication in 2024, older Americans are prescribed more medications than ever, they write. The FDA researchers and colleagues noted that from 1999 to 2000, through 2005 to 2006, any medication used by patients aged 65 years and older increased from 83% to 90%, with little change in usage from then to the present. 90% of all elderly are taking prescription medications. The most common ones are the ones that cause cataracts. For purposes of this article, everybody, they're going to use a term. Polypharmacy was defined as using 5 or more medications that they are being prescribed, and then hyperpolypharmacy as using 10% or more medications. Did you know that 65 years and older people in America, some of them are on 5 drugs for life, some are on 10 or more drugs, and they have a term for that? Polypharmacy means over 5 drugs that they're taking every day. Hyper is more than 10 medications. Let me show you these numbers. The results indicated that polypharmacy, more than 5 drugs, went from 2017 to March 2020. It went from 23% to 43% of all of them. I can't believe that. 23% of all people 65 years and older were on 5 drugs. And over that period of 3 years, it went up to 43% of all of them. Now, researchers reported that from 1999 to 2000 through 2008, people on more than 10 drugs at a time went from 1.8% of 65-year-olds up to 6% of all 65 years and older Americans by the year 2020. That's absurd. Now, this graph, I'm going to show you why it is more people have cataracts than ever before and why America sucks the most at keeping its citizens healthy. The title of this graph is the percentage of seniors aged 65 years and older that had a select number of chronic conditions, chronic illnesses they've been diagnosed with as of 2021 by country. Now, if you look at the graph, I've actually blocked it out so you can't see the actual bars. On the left, you see the names of the countries, and you'll see the United States is at the bottom. It starts with the Netherlands and goes down to the U.S. At the bottom of the screen, I just highlighted with a red bar. The blue graph you're going to see here, the blue bars, represent citizens 65 years and older in each of these countries. What's the percentage of them that have been diagnosed with at least 3 chronic illnesses that they are being prescribed drugs for? The black bar is the percentages of people with 2 medical diseases and being prescribed drugs. And then how many of that population, 65 years and older in each country, have at least 1 chronic illness and have been diagnosed with it? United States is at the bottom. The blue bar is the worst. The United States, look at the bar graph, 42% of all Americans 65 years and older have been diagnosed with 3 chronic illnesses or more, which is higher than all other countries that have been surveyed. America is the sickest. America is the most medically diagnosed country in the world. It's also the most prescribed drug company in the world, and this is why we are the sickest, most disease-ridden, and cataract-ridden country in the world. I just want to blow that up for you. No other country even has 40% of its senior citizens with 3+ chronic illnesses. Only the United States does. What country prescribes the most drugs? The United States, the greatest absolute prescription drug spending as a country of all countries in the world, and spending as a country, its spending per capita on drugs is still significantly higher than that of other countries. What country uses the most prescription medications? The 2023 data suggests the average number of medications taken is 4. Research on prescription drug spending suggests that the United States consumes the most prescription drugs on Earth. What is the most medicated country? The United States is the most medicated country in the world, according to the National Center for Health Statistics, where antidepressants are typically provided for those under 60 and where an estimated 50% of the population uses prescription medications. Ask your doctor if medications are right for you. What country develops the most drugs? The United States of America has the distinction of being the largest producer of medicines in the world. What country uses the most pharmaceuticals? The United States was the largest national pharmaceutical market in 2022, making up over 42% of the total drug spending worldwide. America makes the most prescription drugs, America consumes the most prescription drugs, and we have the most chronic illnesses on Earth. Do you want to know why? Because you're all drugged. Posterior, subscapular, and nuclear cataracts. Nuclear cataracts are the most common. After vitrectomy. Vitrectomy. Do y'all know what vitrectomy is? This is in the Journal of Cataract and Refractory Surgery. This is a cataract. I mean, not a cataract, sorry. This is retinal detachment. And there's a procedure for fixing retinal detachment. It's called vitrectomy. And this is just a little video that shows it. Now that we have summarized that the United States of America is the most drug country on Earth, including those prescription drugs that are known and probable to cause all cataract formation. Now that we've summarized that, it's not just medications they know that cause these cataracts. This on the screen is a research study from the Journal of Cataracts and Refractive Surgery for eye doctors. It's titled Posterior Subcapsular and Nuclear Cataract After Vitrectomy. Now, let's not go off this screen yet. Nuclear cataracts are the type of cataracts that's right in the middle of your eye. It was the first of the 3 I showed you earlier. Remember, they say the most common cause for this is age-related. Not true. I just showed you all the prescription drugs that Americans and Australians and everyone around the world are pumping full in their bodies that are annually increasing to cause these kinds of cataracts, and the drugs called corticosteroids and inhalers that they know causes posterior subcapsular cataracts. That's on the title of the screen. So these 2 types of cataracts of the 3 total, posterior subcapsular and nuclear cataracts after vitrectomy. Now, in case y'all don't know what vitrectomy is, because you're not an eye doctor, I'm going to show you. I didn't know what it was, so I'm going to show you what it is. And here's a short little video describing what this procedure is. It's primarily for retina detachment. Here we go.
During a vitrectomy, your ophthalmologist makes a tiny incision in the sclera, or the white of the eye. A small instrument is placed into the eye to remove the vitreous gel. Once the vitreous is removed, your surgeon will inject a gas or silicone oil bubble in the eye to push the retina back against the wall of the eye. The tears and weak areas of the retina are then sealed with either a freezing probe or a laser treatment.
And now you know what vitrectomy is. All right, so let's get back to the actual presentation. In this study, talking about the 2 types of cataracts created by this procedure, the purpose of the study, they state, is to examine the morphological changes, the disease changes, in the post-vitrectomy lens and to monitor the development of these changes over time. This was done by the Oxford Eye Hospital in the United Kingdom. In this study, 33 consecutive phakic patients having pars plana vitrectomy were recruited. A characteristic transient Posterior subcapsular cataract was present in 89% of those who had this procedure within 24 hours of surgery. 89%. That's 90% of all people who had this procedure done using what's called tamponade, tampon to stop bleeding. Okay, that's what it means, tamponade. 89% of people within 24 hours develop this particular cataract called subcapsular, sorry. Of the patients who had vitrectomy without tamponade, stopping the bleeding, 9%, 1 out of 11, developed similar changes to their lenses. The nuclear type cataracts developed in 61% of those patients that had this procedure, and in 50% of those who got the procedure without having to stop bleeding, called non-tamponade patients. A longer-term review of the same patient's case notes revealed nuclear cataracts, which they say is only caused by aging, in 67% of those who got tamponade surgery included, and 30% of those who had none of the stopping of the bleeding in their procedure. Look at this number, 18%. That's almost 1 out of every 5 of non-tamponade cases, and 67%, almost 70% of those with tamponade cases had cataract surgery after 10.7 months and a 12.4-month follow-up, respectfully. So those who had retinal detachment, who got this vitrectomy surgery I just showed you a video of, 18%, 1 out of 5, and 67%, 14 out of 21, had to schedule cataract surgeries to have cataract surgeries done within 10 months of that surgery and 12 months of the tamponade surgery, where they have to like stop the bleeding or where the tears are. So this is not age-related. They know this procedure alone within 24 hours causes cataracts to form. And up to 70% of everybody who has this procedure has to have cataract surgery within 1 year. It's not just ages. Vitrectomy and tamponade produced a characteristic transient post subcapular cataract in the immediate post-operative period, the immediate, right afterwards. And the acute changes resolved, but were followed by accelerated nuclear cataract formation called opacification. And to remind you what a nuclear cataract looks like, it looks like that. I'm Dr. Ardis. This is the Dr. Ardis Show. These are the causes of cataracts. How many of you learned something today? How many of you know people on prescription medications you've known about, or you yourself are on, and now know that they could be what is known to cause cataracts to form and are probable, diagnosed, and published in research studies to cause cataracts? Here's our QR code again to be notified if this was helpful. Remember, part 2 is coming up. Remember our new book, Moving Beyond the COVID-19 Lies, a #1 bestseller on Amazon right now. Sharing a bestseller spot with Melania Trump's book. Go get it. You need it. Your loved ones need it. The subtitle of the book is Restoring Health and Hope for Humanity, and that's the goal and intention behind the entire book. I am Dr. Bryan Ardis. This is what your medical doctors are not going to tell you about cataracts. Cataracts affect millions of people around the world. Vision loss affects millions of people around the world, and what you don't know is the majority of you being prescribed shots, medications that actually are known to cause cataracts to form. Now, I want you all to be aware that when I showed the video of the surgery called vitrectomy, that is for retinal detachment, which leads to blindness. Also, the procedure leads to cataract formation. There are 2 very popular drugs, including one of them, 2 of which are called Ozempic and Wegovy. They are the same drug. These 2 drugs are being promoted for weight loss, diabetes, and heart disease. Wegovy was just approved by the FDA a few months ago to be given to senior citizens to be covered by Medicare for any senior citizen who's been diagnosed with any heart disease. Wegovy and Ozempic are made from a venom protein from the Gila monster lizard in the deserts of the United States of America. The venom inside Ozempic and Wegovy is called Exendin-4, EXENDIN-4. In the Ozempic and Wegovy research papers and on the product details on drugs.com and other outfits that share side effect knowledge published about drugs, Ozempic and Wegovy, are published to cause blindness, particularly in those with diabetes, because it accelerates what's called diabetic retinopathy, which leads to 20 times more blindness in those that use Ozempic and Wegovy. That is published in their literature. Diabetic retinopathy leads to retinal detachment, which also leads to blindness, the vitrectomy surgery, which also will lead to cataracts. So if you don't want cataracts, ask your medical doctor if the prescription drugs I just showed you in this presentation are right for you. And if your medical doctor knows that what he is prescribing is published to cause cataracts that millions of people are having to succumb to restore their vision, when in fact there are no natural remedies and preventative measures. Number one, you're learning here, avoid the drugs that are known and published to cause cataracts. Inhalers for asthma and COPD, they know that causes it. Also, the prednisone, glucocorticosteroids, and the like, what we just actually presented to you, these are known to cause cataracts. The more you avoid those, the risk for cataracts goes down. And remember, we highlighted, the researchers highlighted this. It appears there is a large investment being made to make sure those prescription medications that cause cataracts are continuing to be prescribed to people all over the world at increasing rates each year. And with that, you're going to see more and more cataracts, just like the NIH showed. And what you're about to get in part 2, which will be coming up right after this podcast in the next week or two, is the antidotes to prevent cataracts and what is published and known to reverse them. You're going to be shocked and excited. I was thrilled to put this together. Part 2 is coming up. This causes for cataracts part of the presentation was too big. I thought to compile both of these together and make one big presentation about cataracts. So now we've done 2. Part 1 we've just completed. Part 2 is coming up. Make sure you share these with your loved ones far and wide. God bless you. We love you. Thank you for spending time with me today. I am Dr. Ardis. This is the Dr. Ardis Show. We will see you next time.